Well, thank you for staying with the Money Report Town Hall session. We're still continuing with the questions around the vaccine. Grace Toroitich says, what is the reason behind getting infected with the virus even after taking the jab? Does that mean that the jab is not working, Dr.
Thank you for that. I just want to underscore that the vaccine does not protect you against from infection. The vaccine protects you from disease. It means the vaccine will not block the virus from coming to your body, but the vaccine will protect you from really the virus causing you the very terrible symptoms or perhaps killing you.
Yeah.
So the vaccine protects you from severe COVID disease and death. Having said that, in most instances, the vaccine reduces the chances that you will be able to spread the virus, because then you are not harboring it as much because you've been protected from disease.
Yeah.
It protects you to a limited extent from being able to transmit the virus. So again, having been vaccinated does not mean you will not contract the virus. It means that you'll be protected from the severe or terrible symptoms that come with the virus having gotten into your body, and you'll perhaps be protected from death from the virus coming into your body.
That's why you still have to wear your mask anyway, right?
Yes, that's why you still have to observe the protocols.
Okay. Mercy Juma says, I got my jab but no SMS yet. 3 weeks on. What proof will I present to get the second jab?
Thank you. So quite a number of Kenyans have gotten their jabs, but they've not quite seen the SMS. You may acknowledge, and like you saw a while back, we had very, very long queues in Bagadi and a number of health facilities. So the people who are managing the system at that particular point in time were a bit overwhelmed. So they're playing catch up in terms of getting the data entered within the electronic system. So I just want to reassure you that the messages will come through, that your details have been captured, and when you go to check and when you due for your next dose, you will actually find that the details are there. So we shouldn't quite worry as much.
Okay.
Yeah.
Let's see here. Amrukan Bantu says, why are we not saying that this is an experimental vaccine? The manufacturers will only release results and studies in 2023.
Now, this is not an experimental vaccine. This is a vaccine that is being deployed to combat the pandemic. Now, it's not by coincidence, rather, that the vaccine is coming in now when the pandemic is at its peak. We need it more than any other time. Now, looking at what the vaccine can do to us, and looking at as the natural infection can do to us in terms of being protected, we would rather go with the vaccine, because then it doesn't come with the consequences of severe disease, it doesn't come with the consequences of death, it doesn't come with the consequences of the impact on the economy that we have seen. So it is not experimental, it is a new vaccine, and it is designed to deliver us from the effects of this current pandemic.
Okay.
Yeah.
Dr. S. Jesse says, please ask Dr. Collins why some people experience side effects after COVID-19 vaccination while others do not experience any side effects at all.
So thank you. So we are unique in our own ways. Not any two people are similar, or not any two people are the same. Just like when we get a flu, there are those people that actually are bedridden by just getting that flu, but there's some people who actually brush it off and within a day they're fine. So the immune reaction to the introduction of a vaccine again varies from person to person in the same way. There are those people, and majority, close to half, do not quite have any side effect. They do not exhibit any untoward symptoms. A small proportion, perhaps about 30%, might have those mild symptoms we talk about, a bit of pain and swelling, a bit of fever, a bit of fatigue, and it goes off. Again, it's the uniqueness of the person that we are, that people react differently to different exposures.
Okay. Your namesake here, called Tabu, says, will the AstraZeneca vaccine stand the test of time should a mutant strain come calling?
Yes, it will, and I know many Kenyans have been asking why, we have the AstraZeneca vaccine, we have the other vaccines we are rolling out, and we have new variants coming in from South Africa, we have from Britain, and all of that. First of all of these variants are COVID-19 variants. So the immune response that is mounted from any of the current vaccine candidates is broad and protects you to some extent from all of these variants, even as they mutate. Now, the vaccines that were developed against the variants that have been there, that are circulating currently, that have a wide circulation. So they may protect us most effectively from that particular variant. But even with the new variants, we have, like I said, broad-based immune response that protects us to a significant extent from severe disease and death from this particular variant. So it is still as effective, and they should still take it.
Okay. Yeah. Let's bring up the questions that we have on video. There's quite a number of them. Let's bring up the first two.
What can Kenya do to improve the capacity, maybe to manufacture the vaccine? Just like we have seen the other countries are starting the conversation. A good example is Rwanda. So what can we do?
Now that the government is insisting that schools will be reopened on 10th May, what are the measures that they have taken to make sure that students maybe get a vaccine or something to prevent them from the spread of COVID-19?
The issue of students, Dr. I think the first one you already answered.
Yes. The issue of students, you realize, Trevor, that within this first phase of vaccination, we prioritized instructors within our educational institutions. The instructors are teachers and anyone else working within the context of an educational institution. We are protecting them because they are most at risk of severe disease and death. The children, as they go back to school, we are protecting them with the COVID-19 protocols that we have in place, that they wear masks, that they social distance, that they observe hand hygiene, that they observe respiratory hygiene. And this is also because the vaccine that we have, again, is not being given to children under 18. So we have that dual sort of like role to be able to ensure the functioning of our educational institutions as it is. In the next subsequent phases, we will be able to then target the other vulnerable populations. But the vaccination of teachers and instructors, the deployment of COVID-19 protocols in schools is to ensure the continued functioning of education institutions.
Okay, let's bring up the other questions.
I have received my first jab. Supposing by the time I'll be due for my second one, they run out completely. What will happen to me?
Could we now explain what is the essence of having a vaccine, if at all it's not going to prevent you from being infected again?
Dr.
Thank you. So I want to assure Kenyans that we will have the second dose availed to those who are due to get it. Remember, most Kenyans received their first dose in this month of March. When are we having our 8 to 12 weeks ending? Is end of May and in June, by which time we will have received the second shipment of the AstraZeneca Oxford vaccine a bit earlier. Number two, like I did share before, you would only need a barrier to prevent a virus from coming in. But remember, the vaccine is being introduced in the body to not block the virus from coming in, but to protect you against the effects of that virus on the body should it get into your body. So the objective of the vaccination as it is to protect us from severe COVID disease and the risk of death from COVID-19 disease.
Yeah.
We may get infected, but with vaccination we may not spread it as fast compared to people who are not vaccinated. With vaccination, you may acquire the infection, but you may not exhibit severe symptoms as in individuals who've not been vaccinated. And therefore, we can imagine that if most of us are vaccinated, just like in other countries like Israel, we would then be able to ease the lockdown, we'll be able to go back to our normal functioning, because then the associated economic risks, the associated risks to life, the associated burden to the healthcare system would then have been lifted.
Okay, let's bring up the other questions.
I'm aware there is what we call Sputnik, there is AstraZeneca, there is Pfizer, there is Johnson & Johnson. We are confused about all this. I don't know the level of efficacy of these vaccines. Which one is the most appropriate to take?
My concern is about those who might be asymptomatic going for this vaccine. How safe is it? Should someone know their status before going for the jab, or how is this handled?
All right, Dr.
Thank you. All the COVID-19 vaccines that have been approved on the basis of them being effective. They have been approved on the basis of them being efficacious. They have been approved on the basis of them being safe. And they've been approved on the basis of them providing us protection. So I want to share with my colleague that all of these COVID vaccines have varied efficacy levels of between 60 to 95%. But like I did share before during our last engagement on this short trevor, I want to encourage us to look beyond the individual, the efficacy in an individual. The importance of the vaccine is not what it does to me as an individual, but what it does to us as a community. That one, we're looking much more at the population effectiveness of the vaccine rather than the individual effectiveness of the vaccine. Number two, this population effectiveness of the vaccine is what will bring with us the impact of reducing the rates of deaths that we are seeing, the impact of reducing the severe disease that we are seeing, the impact of lifting the burden on the economy that we are seeing. And therefore, as we move on, therefore, I would like us to consider, and like I did share last time with you, the beauty of an entire forest rather than that of a tree. It is the consideration of the vaccine dynamics in the population that will give us herd immunity rather than at an individual level. I just want to share with you vaccines that have had efficacy levels of less than 50% have been able to reduce the burden of disease by more than 80% for us. The rotavirus vaccine that we introduced about 6 years ago has just about 50% efficacy. But we can see that the burden of rotavirus disease within our country, children dying from diarrheal disease, has reduced by more than 70%. So the focus is about what the vaccine does for us in the population rather than what it does to me as an individual. Okay. There are no consequences to someone getting vaccinated if they are asymptomatic. Remember, it is the aspects of the immune response of your body to this particular vaccine vis-a-vis the development of the symptoms from COVID-19 disease perhaps occurring at the same time that would lead someone into that confusion of, is it the vaccine making me more sick, or is it the COVID-19 disease making me more sick, and therefore bringing in that bit of confusion. But the vaccination at that point in time does not make your condition worse, does not exacerbate your symptoms. Okay. However, because of this balance that I'm talking about, this is where we recommend that people who are symptomatic, not asymptomatic, people who are symptomatic, acutely ill, high fevers perhaps, with confirmed COVID-19 infection, need to wait at least 2 weeks after they have healed from the infection before they receive the vaccine. That is the basis.
All right, let's bring up more questions.
What measures are you taking to ensure that people in the marginalized areas are able to get the COVID-19 vaccination? What availability measures are you taking?
Daktari, in your own opinion, why do you think India gave us the donations of the 100,000 vaccines, yet in their country there are so many, they are not even enough for them? Or could it be that they were testing whether they'll work for us and therefore for them thereafter? Thank you.
Doctor.
Very interesting question. Perhaps I'll start with my elder's question.
Yeah.
Remember the principle behind COVID, there's a principle of the one world protected. And if India got stuck on all of the vaccines and vaccinated all of their people and did not let go of the vaccines to other people, for as long as the rest of the global community is not safe, then they are not safe. So you are not safe until I am safe. You are not safe until all of us are done what? Are vaccinated. India did not just donate to us. They have shared what they do have with other countries. For example, they did share 50,000 with Rwanda. They did share 50,000 with Ghana and many other countries. So it is that collective global responsibility in the fight against the pandemic. In the marginalized areas, my brother did ask, we have, first of all, to assure equity, mapped out our population. So we have a fairly good idea about where our vulnerable people are, where are our teachers, where are our security agencies, where are our health workers, and beyond that, where are our elderly and the people that we need to reach first. And within these marginalized areas, beyond the level 4, level 5, level 6 health facilities, Trevor, you had me talk about the targeted outreaches. Yeah. We're not waiting for that elderly man to travel 20, 50 kilometers to reach the vaccination center, but rather we are endeavoring to avail the vaccines closer to them through targeted outreaches in places where they can be reached most efficiently.
Okay. Yeah. Gikonyo on Twitter says, are people who have previously suffered or are suffering from deep vein thrombosis safe to receive the vaccine?
Yes, people who have suffered or are suffering deep venous thrombosis can receive the vaccine. However, this should be done under the guidance of a specialist physician, that they need their clotting factors need to be monitored even as they receive the vaccine. We need to be able to be sure that they are actually on anti-clotting medication, just like they were before, so that they can be able to receive vaccines. Remember that in such individuals, even just the process of administering the vaccine itself, the trauma that is caused by the injection can lead to prolonged bleeding, or so to speak. So this is where they need to be under close follow-up of a specialist.
All right. Okia Brian says, are there adverse effects reported in Kenya like blood clots as reported elsewhere?
Yeah, no. So we have reported those adverse events everywhere. We have not had blood clots as an adverse effect reported in Kenya or anywhere in Africa as I speak today.
Okay.
Yeah.
The second question from Okia Brian is still, contact tracing failed. So what mechanisms have been put in place to ensure 100% compliance, to ensure those that receive the first jab receive the second jab, or will they have to just come on their own?
Yeah. So thank you, Brian. Just to share with you, COVID-19 vaccination, unlike the childhood vaccines, is not mandatory. It is voluntary. We share with you information, and this is the purpose of this continued engagement, to be able to debunk the myths and be able to get you to take up the vaccination. So we want to recommend that as many people as possible get vaccination so that we can achieve herd immunity. As we vaccinate for the first dose, we are careful to take the personal identifier details like you can see within the system, and we don't just take your details, we take those of your next of kin so that we can be able to reach you with reminders. For those that have received SMSs could tell these about when you are due for your second dose. Within the context of the health facility, again, we have the community health workers network that we're leveraging on, that you have shared your details. If we are not able to reach you within the contact details that you have shared, we're able to leverage the community health worker network to be able to reach you and inform you of a next dose that is due, so that you don't miss it and so that you derive the highest benefit from vaccination.
All right. Yeah. Matuka Manja says, will the government be providing vaccination certificates to those who have fully been vaccinated? This may soon be a requirement for out-of-country travel.
Yes, the very essence of the system is to document your individual level data, because these will then lead into the provision of vaccination certificates after the second dose has been then given out.
Okay. Mwiti Gilbert, does taking alcohol affect the effectiveness of the vaccine? For how long should one avoid alcohol after receiving the vaccine?
Yeah, so thank you. This is a question I've seen so many times on social media, and I just want to share with you today that whereas alcoholism or severe alcoholism reduces your immune response, there is currently no data to show that the vaccine is ineffective when you take alcohol. So the vaccine is still effective even when you do take alcohol, as I speak. Yeah.
That's a risky statement, Dr. Some people will come, they want to pilot.
It is factual, unfortunately.
Benson, if I'm allergic to sulfur, can I receive the vaccine?
Yes, if you're allergic to sulfur, you can receive the vaccine. The only contraindication for you, or rather, the only people who may not receive the vaccine are those people who are having a severe illness, an illness severe enough to warrant their admission, or they're being acutely ill with COVID confirmed infection, and or they're allergic to the active ingredients of the vaccine, or have reacted in a severe way to a previous dose of the COVID-19 vaccines. But the others, if you're allergic to sulfur, if you're allergic to eggs or chicken, please, you are eligible for vaccination.
Okay. Yeah. And Joel Tembe says, is there a need to vaccinate young people with no underlying conditions now that the vaccine has an efficacy level of only 76 to 79%?
So, first of all, I want to share that the country, we will move to vaccinate the entire adult population towards a move to gain herd immunity, so that we can get as many of our individuals protected to be able to gain herd immunity. At this point in time, there is no need for us to be able to vaccinate people who are under 18 years. And this is because the vaccine has not been tested adequately in that particular population. But then again, also sharing that that population does not bear the biggest burden of COVID-19 disease, and therefore the target for vaccination is the older population that is above 18 years.
Joseph M. Kimuchu says, will I need to go to the same center for revaccination?
No, you do not have to go back to the same center for revaccination. And beyond this, just to make it more facilitative for Kenyans who want to access vaccination, there is a self-registration module that is being created and will be rolled out in the next few days, which will allow Kenyans to go online and book the place that they desire to be vaccinated in. So Kenyans will have a choice. They do not have to necessarily go to that particular center. Their details are captured online. They can be able to retrieve them from wherever they are.
Sir Adika says, from a public health point of view, why not concentrate the vaccination within the 5 high-burden counties before rolling out to the low-burden counties?
Yeah. Now, you all realize that we are now not quite talking about 5 high burden and others being low burden. We have crossed that line where COVID-19 now is at the level of community transmission, that every county has literally been reporting cases, and quite a number of those that may not necessarily be reporting cases may be a factor of them not reporting and them not diagnosing, rather than the disease being absent. So to achieve equity and to have every Kenyan have an opportunity to access this vaccine, especially if they're eligible within the first phase of vaccination, we have rolled out the vaccination exercise to every county.
Okay. You had mentioned earlier on that the picture of success is 26 million by mid-2022.
Yes.
Do you believe that is now when we'll officially have had herd immunity, or will the infections be so low that then the economy can be reopened?
So by the time we reach that figure, we do project that the burden due to severe disease, the burden due to death from COVID will literally have been sort of like lifted off, and will be we basically be approaching herd immunity, and we may then be able to resume normal functioning of the economy. And this is from the modeling studies that are coming through.
All right.
Yeah.
As we come to an end on this, Dr. I just wanted you to clarify on this issue of Rwanda, because it seems Kenyans are not letting it go.
Yeah.
They are not happy with your answers this far. They're saying that if Rwanda is able to do it, why not us?
Rwanda has not done it.
Yeah.
Rwanda is in the preparatory steps just like we are. And perhaps, like I did share, we are at an advanced stage within these preparatory steps.
Okay.
So that's what I'd like to share with you.
Mukami Muridi says, are breastfeeding moms safe for getting the vaccine?
Yes, breastfeeding moms can receive the vaccine if they fall within the particular target group for that phase of vaccination. Being that you're a breastfeeding mother in itself does not qualify you for vaccination unless you fall within that category that is being considered for the particular phase of vaccination. Having said that, again, linked closely to that, I know questions have been asked about pregnancy and vaccination. I just want to share with you that whereas the vaccine has not been seen to be to harm the mother or the unborn baby, we do not have a lot of information as to how it behaves within a pregnant mother. So I want to share with you that the vaccination of pregnant women should only be considered if the perceived risks, the perceived benefits far outweigh the risks from vaccination. That means if a pregnant mother perhaps has a chronic medical condition, a pregnant mother perhaps has high-risk exposure, is a nurse, for instance, that is continuously exposed to COVID-19, then we need to be able to offer them the vaccine.
Okay. CPA Hank Kinywa says, if one recovered from COVID-19 before, that means he or she has body immunity, which are antibodies against COVID-19. Therefore, why go for this vaccine?
You need to get the vaccine even when you have suffered COVID-19 and recovered. We currently do not know how long the natural immunity from COVID-19 infection lasts. And even then, you can get reinfection with the COVID-19. You can get reinfection with the same variant or a different variant. So the only sure protection against severe COVID disease and death is for you to get vaccinated, even when you have suffered COVID-19 before.
All right. Dr. I'll give you a chance for closing remarks. I believe we are running out of time here. Can you assure Kenyans that the vaccine will be here on time, and that you also mentioned that the prolonged break in between, it was supposed to be 8 weeks, should it go to 12 weeks, even better?
Yeah, so I want to assure Kenyans that the vaccine will be with us in time for those who received the first dose to receive their second dose, and for those that have not received their first dose to be able to access it. Remember, like I said, we are not making any effort to spare the vaccine for somebody in future, but rather we're making every effort to ensure that the vaccines that we have quickly get to the people that need them most. As I say this again, the vaccine is most effective, the second dose is most effective given between 8 to 12 weeks. So again, this ties in well with the period when we expect to receive our second shot of vaccines. Just to share with Kenyans again, we need to be able to focus and remember that the vaccination exercise is focusing on the community rather than the individual, and it is seeking to protect us from severe COVID disease and death, to lift the burden of our health facilities that are overwhelmed currently, and for them to be able to also allow spending of the same spaces on other medical conditions and other individuals that highly need them, and also to allow us rapidly build immunity within the priority populations so that we can really go back to our normal functioning, so that the lockdown can really be lifted. So this is why we're struggling as hard through other initiatives to deploy the vaccines. We quickly trying to ensure that we have a sustainable supply of the vaccines, that we have a robust health facility level reporting with individual level data, that we're vaccinating daily, that we offer the vaccines free of charge even when it is in public hospitals, and that we continue engaging communities for them to get the maximum benefit from COVID-19 vaccination. Just acknowledging that we are not safe until all of us are fully protected from COVID-19 disease.
So right now, as it stands, our magic number is 26 million by mid-2020.
That's what we are shooting for.
Okay.
Thank you.
Thank you so much for making time. Dr. Collins Tabu, Head, National Vaccines and Immunization Program at the Ministry of Health. And thank you all for sending in all your questions. We endeavor here to ensure that we have all your questions answered in regards to all the vaccines and everything else you may have in mind. I want to take this opportunity to thank you so much for tuning in. My name is Trevor Mbija. It was a pleasure having you with us. Have a good night. Yulanzale says bye. Everybody else who's made this possible also say absolute thank you. Bye for now.